So the group we tested on was 87 rheumatoid arthritis patients with who had been on methotrexate for 20 years plus. And they were all above the age of 8, so it was between 80 and 101, their ages, and only 3 of them out of the 87 had hearing aids, which is bizarre for an age group that old. So then it was, why do these people have such good hearing and they don't need a hearing aid? And then there's a link between the methotrexate use and reduction in atherosclerosis. So then we started thinking, well, is there a link between atherosclerosis and you can use audiometry in order to measure this atherosclerosis in rheumatoid arthritis patients? So when we were testing the hearing of the general looking at graphs of the general population's hearing versus our group's hearing, the rheumatoid arthritis patients had much better hearing, very little, or not very little, but less loss in comparison to the general population. So then we saw that you can, with audiometry, you might be able to track atherosclerosis. The thing is, as far as the patient goes, it's a much easier test. I mean, being a high school student, I know we've taken them in school. We have tests to check our hearing, and they give us certain frequencies, and we raise our hand, like, can we hear it or not? So it's very easy to administer, and I think the patient would be more likely to take that test versus something more invasive, like you said. And as far as the physician goes, it's a much cheaper option as well, in comparison to a different type of scan.